Hi, my name is Dr. Patel and Shaun Patel, and I work at Miami Skin and Vein in Coral Gables, Florida. And today we have a volunteer patient who allowed us to videotape her getting filler injections. The plan on her, I'm going to be using Juvederm UltraPlus, a hyaluronic acid-based filler. Actually comes from the most popular family of fillers on the market. The filler Juvederm is manufactured by Allergan. Allergan happens to also be the maker of several other products we use in our practice, including Kybella for the fat underneath the chin, Voluma for the cheeks. It's a heavier filler that I can use on top of bone. They also make Fabella for the lips, two different Juvederm products, Ultra and UltraPlus, as well as probably their most famous product, Botox. And so today we're going to be using Juvederm UltraPlus, and we're going to be treating this patient's lower face. So today we're going to be using those two Juvederm syringes, and I'm going to put a little bit into the nasolabial folds, not too much, because I think it is normal to have some contouring in the face, some transition in the face, and so a little bit of a nasolabial fold is normal. I'm going to put a decent amount of filler, spend a decent amount of my focus on the prejowl area. She has a very nice chin, but she has some laxity and loss of support here in the prejowl area. And the reason we see this is multifold, but as you age, your skin loses elasticity. You also, most patients don't realize is that you also lose bony support as you age, so the mandible starts to thin, and you lose fat. And so what you see here is there's a little bit too much skin for the amount of support she has, and we're going to kind of put some filler into this prejowl area and smooth out that prejowl sulcus. So a little bit of filler in the prejowl sulcus, a little bit of filler in the nasolabial folds, and then probably off camera she's had filler in her cheeks before with me. I'm probably just going to put a little bit more to soften up to fill in those cheeks just a little bit. We are going to be using a cannula for the prejowl sulcus. I will probably use a cannula in the nasolabial fold as well, although I go back and forth between cannula and needles for the nasolabial folds. I find needles give me better control, but cannulas give me more even spread, as well as the cannulas help minimize bruising, swelling, and just trauma to the skin. So there are certain areas that I absolutely always use the cannula, one of them being the tear troughs. I like to use cannulas in the prejowl. It minimizes the number of sticks and lets me spread out the filler very nicely. And so you're going to see me do that today. Since we're using a cannula, what I like to do is we take out a 22 gauge needle. I use a 25 gauge cannula. And so this is a needle, what I call the entry needle, and which creates a little nick in the skin so that the cannula, which is blunt tip, can actually go underneath the skin. So what I do is, there are some vessels here, and so I like veins that I like to stay away from in this region. And so I just look at the skin and make sure I'm not going into a vein. And then I just create a little nick with this 22 gauge needle. And you can see, if you avoid those veins there, that there's essentially no bleeding there. And sometimes it can be a little bit difficult to see your entry point. You can just put a little pressure and you'll see some blood, or you can pass a quick alcohol swab there and that will do the same thing. I just prep my cannula here. So this is a 25 gauge, 1.5 inch long cannula that I'm going to be using to inject the Juvederm UltraPlus into the prejowl sulcus. The cannula I'm using today actually has a marker showing me which side the hole is at the tip of the cannula, and this brand is the Sculptra brand from Cosmo, France. We'll take this 25 gauge cannula, and we have that entry point right there. And all I do is kind of lift up the tissues that I want to go below. Kind of just slides in if you're in the right plane, and you can feel the tip of my cannula right there, so that's where I know the cannula is, and I go all the way up to the corner of the mouth, and what I do is I put a little filler in there to give it a little bit of support at the gently lie down. You can see not too much bleeding there.
How long does it last?
The filler lasts in this area about a year. Juvederm UltraPlus I find lasts somewhere between 9 and 14 months. I think Ultra itself is on the lower end of that range, 9 months. UltraPlus, which we're using today, closer to 12 to 14 months. So you can see already we're starting to fill in that prejowl sulcus. She still needs a little bit more. You can see those shadows there still. So we're just going to go in there very gently. Here now, you can kind of see that we've been able to revolumize that area right there. Very nice, very natural look right there. And I've used at this point 0.4 cc's of filler. I'm going to put just a tiny bit more in here medially. You can see right there, we have a very nice natural result, filled in prejowl sulcus relative to the other side where you have a lot of laxity here. You don't have as much laxity here. So since we only used 0.5 cc's of Juvederm UltraPlus to get this result on this side, I anticipate that's what I'm going to use on this side as well. You can see the tip of my cannula. I can feel it right there. And I encourage every injector to know exactly where their tip is. That's 0.5 cc's on this side, 0.5 cc's on this side. I do think she's going to need probably another 0.1 to 0.2 cc's on this side, which I'm going to open up another Juvederm UltraPlus for. Result. And so now I'm going to jump over to the nasolabial folds. For this part of the procedure, I am going to use the 25 gauge needle that is included in the Juvederm kit. Comes with the filler. I often get asked by other doctors what plane I'm injecting in. These are called dermal fillers, but I think they're a misnomer because most injections are not in the dermis. We're actually going into the subcutaneous fat, the superficial subcutaneous fat, maybe at best the deep dermis. The only time we really do true intradermal injections is when we're treating fine lines with a filler like Vabella or Restylane Silk or Bellatero. So it's also important for the doctors out there watching that right around the corner of the mouth, just slightly lateral to the corner and slightly superior to the corner. The facial artery actually is as superficial as it gets in this region, and so you'll often run into bleeding in this area, but obviously this is probably the area where you want to be very cognizant of intravascular injection, and the way to avoid these intravascular injections is obviously to know your facial anatomy, as well as slow injections in the appropriate plane, while always keeping the needle moving. So you can see big smile for me, and you can see a nice correction, soft correction, not overdone. Relax for me. When used properly, a small amount of filler can go a really long way. And what I mean by that is when patients are selected appropriately, the appropriate filler is used, and the appropriate injection depth the filler is placed in the appropriate injection depth. Now, because she's had filler before in her cheeks, we've addressed some of that midface volume loss. Ideal filler in that area, of course. In my hands, my preferred filler is Voluma, but Radius, Sculptra, Restylane can also be used in those areas. So that's the injection. It took me a few minutes, but we used Canula to inject Juvederm UltraPlus into the prejowl sulcus. We also did a little bit of filler in the nasolabial folds, and then I put a tiny bit of filler into her right cheek just to balance a slight asymmetry. Slightly less volume was in her right cheek than her left cheek, and so I just balanced that out. You can see post-procedure she's just icing, but you can see very minimal bruising or swelling immediately post-procedure, and a big part of that is the cannula that we used in the lower face, as well as the icing before the procedure and after the procedure. Total used in this case was 1.7 cc's of Juvederm UltraPlus, so about approximately two syringes of Juvederm UltraPlus. And then I expect this result to last somewhere between 9 and 14 months. I tell most of my patients to see me at least once a year for filler maintenance.